Bismillahirrahmanirrahim. Hello everybody. A 31-year-old preemie gravida at 7 weeks of gestation is brought to the emergency department by her husband due to vaginal bleeding and a lower abdominal pain. The bleeding began 4 hours earlier, and the patient has saturated 3 perineal pads in their time. Her abdominal cramping has become progressively more severe and unresponsive to acetaminophen. She has no fever, chill, or abdominal discharge or abnormal vaginal discharge. The patient was treated at age 18 for chlamydia trachomatis cervicitis. Her surgical history include a loop electrode excision procedure for high-grade cervical intraepithelial neoplasia, but she has had normal PAPS test since. The patient takes a prenatal vitamin daily and does not use tobacco, alcohol, or illicit drug. Temperature is 37. Blood pressure is 100 by 76. Pulse is 112 per minute and respiration are 14 per minute. Pelvic examination revealed blood clot in the vaginal wall and active bleeding from a dilated cervix. Bimanual examination demonstrate pelvic examination revealed blood clot in the vaginal wall and active bleeding from a dilated cervix. A bimanual examination demonstrates a 6-week sized tender uterus. Ultrasound revealed a gestational sac in the lower segment of the uterus, a simple cyst in the right ovary, and a free fluid in the posterior cul-de-sac. Which of the following is the most likely diagnosis of this patient? So first of all, this patient came to us at 7 weeks of gestation, and she having vaginal bleeding and lower abdominal pain. On pelvic examination, she having a blood clots in the vagina and active bleeding from a dilated cervical os. On ultrasound, there is a gestational sac in the lower segment of the uterus. So what is the diagnosis of this question? First, she came to us at less than 20 weeks of gestation with active vaginal bleeding and abdominal pain. On pelvic examination, she having blood clot in the vagina and the cervix and the cervical os is dilated. Third, on ultrasound, she having a gestational sac in the lower segment of the uterus. So based on these three, here the diagnosis of this question is inevitable abortion. Inevitable abortion. So here the correct option is choice E, inevitable abortion. I will show the photo of inevitable abortion. So this is inevitable abortion. First of all, this patient have the gestation sac at lower segment of the uterus, and second, she having a dilated cervical os with active bleeding. So what is inevitable abortion? Inevitable abortion is the active bleeding at less than 20 weeks of gestation. The patient having vaginal bleeding. On pelvic examination, she having a dilated cervical os, and ultrasound, she having the product of conception at the lower segment of the uterus. So here the correct option is choice E, inevitable abortion. This patient has pain, vaginal bleeding, a dilated cervix, and product of conception in the lower uterine segment, a presentation consistent with an inevitable abortion. Her other ultrasound finding of a simple ovarian cyst, corpus luteum, and free fluid in the posterior cul-de-sac are the result of physiological processes of pregnancy. So as we can see here that this patient having a simple cyst, I will highlight it here in the right ovary, and the free fluid and the posterior cul-de-sac. So this is normal physiological process during the pregnancy. So treatment for inevitable abortion include expectant management, that is prostaglandin administration, or surgical, that is suction curettage, which depend on patient hemodynamical stability. Come to the incorrect one, acute cervicitis. So acute cervicitis present with friable cervix with mucopurulent discharge. B, cervical insufficiency. So cervical insufficiency refer to painless cervical dilation during the second trimester that result in loss of pregnancy. The presence of lower abdominal pain from uterine contraction excludes cervical insufficiency. Choice C, ectopic pregnancy. An ectopic pregnancy present with unilateral pain and light vaginal bleeding. Ultrasound revealed complex adnexal masses rather than a simple cyst. D, hydatidiform mole. A molar pregnancy is characterized by first trimester vaginal bleeding associated with expulsion of vesicle and uterine size greater than dates. Choice F, missed abortion. Patients with missed abortion are typically asymptomatic or have loss of pregnancy symptom, that is, for example, nausea. There is closed cervix, and ultrasound demonstrate a fetus with no heartbeat. Choice G, threatened abortion. A threatened abortion present with bleeding, closed cervix, and ultrasound revealing an intrauterine gestation with a normal fetal heartbeat. Thank you.